Welcome to osTEAo, that's with a capital TEA, where osteo warriors in treatment and recent survivors spill the tea on all things osteosarcoma and cancer from the adolescent and young adult patient perspective. Listen in on our honest and personal conversations about our osteo experiences, stories, and who knows what else. I don't know. We just keep talking sometimes.
This podcast discusses all aspects of the young adult cancer experience in a conversational format. In today's episode, we will be discussing our own scary stories through treatment and how to cope with the unexpected. Our conversation will be appropriate for young adults and up. Audience discretion is advised. Like and follow MIB Agents on social media for all the intel.
All the hot goss is on the MIB social media pages. MIB Agents has a new monthly newsletter called Connective Issue, like connective tissue, really digging the puns, not gonna lie. It includes info of interest to our osteosarcoma community, including recent news and papers, open clinical trials, job postings, info about MIB events and programs, and spotlights on members of our community. To make sure you get all this info delivered to your inbox every month, join our community. A link will be provided to join in our episode description.
And for anyone in the Houston area, MIB will be heading to... What?
I said H-Town. Sorry.
Oh. Sorry, it cut off on my end, so I was a little confused. Okay. But MIB will be heading your way next month. Join us on November 30th from 5 to 7 p.m. for an MIB mingle at the Blossom Hotel, which is right next to MD Anderson. Everyone in the osteosarcoma community is invited, and email events@mibagents.org for more information.
Thank you, Vicky. Well, hi, everyone. Welcome to the fifth, I can't believe it's already the fifth, episode of osTEAo, the Osteosarcoma podcast. This is your first time tuning in with us to Osteo. My name is Mia. I'm an osteo warrior and the vice president of the MIB Junior Advisory Board. To give a quick background on, my cancer journey, as we like to call it. I was diagnosed with osteo in 2018 when I was 19 years old. I went through MAP chemotherapy for about 9 months. I had a limb salvage surgery right before I started MAP on my right tibia. I relapsed about 8 months after finishing MAP with metastases in both lungs. I've tried multiple other chemo regimens and an immunotherapy treatment, and I'm currently waiting on another chemo that I'll be trying. Just waiting for authorization on that. I've also had 2 thoracotomies and upwards of 20 cryogenic and radiofrequency ablations for metastases on multiple bones and in my lungs. Of course, with us today is our lovely host and icon, Vicky Hoy.
Hi, everyone. My name is Vicky Hoy, and I am also a Junior Advisory Board member and Osteo Warrior. I was diagnosed in July of 2021, received 10 months of MAP, took me a little longer, along with a limb salvage to replace half my pelvis and replace my hip, and then a thoracotomy in my right lung. Since finishing my treatment in May, I am now a freshman at Villanova studying finance, and I'm getting very worried because I got my big scans coming up for Thanksgiving break.
Oh, yeah.
Yeah.
Spooky season. I know it's after Halloween, but still, there's nothing spookier than anxiety. Yeah. There are a few things that are spookier, and we're going to get into those today. But seriously, anxiety, which we've talked about in many of our episodes and is always a common theme, is terrifying and never feel like you're overreacting when you're worried about scans, because it is, you never know how they're going to turn out. And obviously, you can just hope for the best. My strategy, I expect the worst, but hope for the best. So then I'm just pleasantly surprised if it's better. But don't try that at home if it doesn't work for you. Anyway, we cannot start our episode without our first segment of the episode. We start every episode with this. What's the tea? No, like literally, what is the tea? We'll be going around and sharing what we're drinking today. It's just Vicky and I, so we're just gonna be going back and forth. We're gonna be giving it an honest review. So in this cute little mug that my mom got, I am drinking elderberry immune and stress tea. It tastes a bit like coffee because I forgot to descale the Keurig. So I'm gonna give it a 6 out of 10. It's also room temperature at this point. But bonus points for immunity and stress relief. So, you know, all good things.
Plus,
What are you drinking, my dude?
my cup is on the other side of the room right now. I don't have it with me. It's looking at me, but I don't have a tea. I had the Mio Arctic Grape, which is
Oh
like
yeah.
a electrolyte drink mix.
Mhm.
Absolutely love it. Can't get enough of it. Maybe a 10 out of 10. Honestly, like I have it all the time.
I respect it. I respect it, dude.
Oh
And I
yeah.
think that that's 3 letters and starts with MI. I get behind.
Yeah.
So uh so Vicky, do you want to start with your story? Because
Yeah.
let's get spooky. Let's get spooky, babe.
Yeah. Yeah. I feel like I didn't really have that many scary stories, but
Yeah.
there was definitely one that stuck out. So I wanted to share that today. So after my limb salvage surgery, which was in November of 2021,
Mhm.
I was in the hospital for 6 weeks.
Jeez.
Even though they told me it would be like 10 days post-op, I'd be in the hospital,
Typical
6 weeks.
hospital time.
Oh yeah. It was incredibly difficult to recover from the surgery, and I was struggling to make it through even all the pain meds I was offered. On top of this, I had to start back up with chemo again because you really aren't supposed to start any later than 6 weeks.
Yeah.
I didn't really feel ready at all, but I didn't have any option. I had to start up again with cisplatin, which for those of you who haven't had it, it's absolutely horrendous.
Bad.
I'm
Bad, bad,
always,
bad.
oh yeah, I'm always incredibly nauseous no matter how many anti-nausea meds I'm given. And of the time I was already on 2 different narcotic painkillers, I was then given cisplatin, Zofran, Atifen, Reglan, hydroxyzine, and I think one other, but I couldn't remember the name. But I was still nauseous. And when all the meds set in, I immediately went to sleep.
Mhm.
I remember one of my friends came to visit me. This was actually the only time she was able to visit me in the hospital. I completely wasted it, but she came at 1 p.m. and I closed my eyes, I opened them, and then she was leaving because it was already late in the evening. The
Jeez.
doctors kept trying to wake me up, but I just couldn't stay awake. I just felt so out of control and out of touch with my body, and I couldn't even go to the bathroom. So they kept an eye on me, but didn't give me any more anti-nausea meds. And then into the night, I couldn't keep awake and hadn't gone to the bathroom the entire day, even though I had been on IV fluids all day long. Eventually, I started vomiting very interesting colors.
Spooky.
Yeah, I definitely spooky colors, and was barely able to stay awake while I was vomiting, which is never a
Jeez.
good
That's a
situation.
bad combo.
Yeah, that really is. They were asking me all these questions that I understood, but I really couldn't answer. At one point, they were asking me what the date was. I had no idea who the president was. Really couldn't tell
That's a
you.
tough question for people our age,
Yeah,
especially over the
yeah,
past couple of years. It changed. There was a change.
yeah. There was. But I didn't get any names down. But I was hearing what they were saying, but nothing was kind of working in my mind. Then a group of nurses and doctors rushed down with me to the CT scan, I think around 1 or 2 in the morning,
Mhm.
because they thought I maybe had an aneurysm.
Oh, jeez.
They couldn't figure out what had gone wrong, even though in my brain I was like, you've given me too many meds. Like, I feel like it's pretty obvious, but I couldn't say that because I don't know why I couldn't talk.
It's hard to communicate
Personally,
when you're throwing up different colors and
yeah, that
feel
would do
awful.
it. Personally, yeah, I don't think they checked the interaction between the meds, and they really hadn't been able to weigh me for a few weeks. So I don't know if I'd lost a lot of weight at that point, because I could barely stand up after my surgery. But they found out that it wasn't an aneurysm and that I would make it through. And then after being asleep for another 20 hours, I woke up by myself,
It's a
which
record.
is, yeah, quite a long sleep. The doctors then sat down with my parents and I and told us my oncologist had approved for us to start more cisplatin right then. But I wasn't ready. I really wasn't ready. So I begged
No
them
one's
just
ever
for
ready.
no. But especially at that point, I was like, am I gonna survive? Like if you give it to me again? Um, so I begged them for one more day, and that's all I was given, one day. But in order
It's
to
not enough
prevent
time.
in order to prevent another dosage mix up, I wasn't given most of the anti-nausea meds, so I
No,
had to bear the full brunt of cisplatin while being in extreme pain from surgery without anything.
that's
Um,
that's abuse. That
yeah.
is just
But if anything comes of this story, it's that you need to communicate the effects of the medication you're taking and if the
mhm.
dosages are correct and what sort of interactions all the meds have with one another. Having gone through treatment, you're given a lot of meds without second thought. People just want to follow the protocol, but the protocol really doesn't always work and it doesn't work for everyone the same way. So make sure you vouch for yourself because not every instance will someone else. And if you know something wrong has happened, speak immediately and don't wait until you've lost control like I did. Well, that's the scariest story that I have. I know, Mia, you have a lot of scary stories yourself. So where do
I,
you want to begin?
I got some up my sleeves. Um, Specifically this big one, but I want to touch on your story first really quickly because that was scary. When you're throwing up that much, you're barely conscious, you don't know what's going on, you're delirious. I myself have had ICU delirium, which I'm going to touch on in a minute, and that was terrifying because you're aware, but you just can't communicate your needs, your wants, what's wrong as accurately. And so it's just really, really terrifying. But I'm just so glad that you were okay, that even though they, potentially didn't check things out, that you were okay and just needed sleep. And that you advocated for yourself to get that extra day, because I know so many patients who just get pushed on stuff. So even though they should have given you more than that, speaking up for yourself is one of the most powerful things that you can do. Even though the doctors are the experts, you know your body best. And that is something that I feel like we try to, kind of like hammer in every single episode that we do here is be your own patient advocate, speak up, because the doctors can adjust to what you really need, and there's always other options. Because sometimes we're really just seen as a patient rather than a person. Sometimes it's hard for doctors to differentiate the two, especially when they're really busy, there's a lot of rounds, the floor is full, what have you. And they'll just push protocol, like you said, without really checking in with you as a person. And so just be a patient advocate, have caregivers and friends who will speak up for you too. Just, it's hard, it's rough out there. And I just, my hat is off to you for getting through all of that and everything else that you have. So today, the date of filming, we're filming this on Monday the 17th, not Friday the 13th, even though this is our spooky episode. Today is what I've dubbed as my ventiversary. So you will figure out why throughout the story. So a year ago today, so October 17th, 2021, I woke up at 2:30 in the morning with a terrible wet cough. I mean, like hacking up a lung level, pretty much the worst cough I'd ever had. And I was convinced that, of course, that when you're coughing, the first thing you think, recently is COVID. Yeah. So I thought I had COVID. And I had 100.3 degree fever. And as all, people, anyone who's gone through chemo, that if you're 100.4 or above, your oncologist wants you to go to the ER. So I was 100.3. So my mom was like, let's go to the ER. And I was like, no, I don't want to go to the ER because the ER is not really a fun place. And I knew something was wrong, but I just didn't want to face it. And I was so tired and I was so out of it. I'd also recently had a lung ablation. They froze a tumor in one of my lungs, and coughing is pretty common after that. So I didn't think it was too alarming. Thankfully, I was sleeping in my mom's room that night, so she was on it right away. If I had been in my room, I might not be here today. That's actually part of our own protocol at home. If it's been within like 2 days of me having surgery or chemo, I sleep in her room with her, because that way she can see right away if there's some sort of emergency, where I can't wake up, and she'll get up and make sure I'm breathing, stuff like that. But being the amazing mom that she is, she immediately sensed that something was wrong and called the on-call oncology team, on-call, anyway, to let them know that we'd be heading their way soon to the ER. I protested and protested. No, I don't want to go. I don't want to go. But I finally gave in when I realized I was almost too weak to go down the stairs. I actually had to kind of like butt slide down the stairs because walking down was too difficult for me. I was too woozy. We got to the ER, but my fever had dropped and I was actually feeling better. So I, it was a little smug and I was like, I told you so, to my mom. I kept, being just an asshole, for lack of a better term. And then my cough started getting worse again. And due to COVID protocol, my mom could be in the waiting room, but could not be in the actual room with me in the ER. So I was alone, terrified, and I started to feel like I couldn't breathe. After an x-ray and blood cultures, the doctors had determined that I was going into septic shock. My immune system was so weak from high dose steroids that I had been on to treat a liver issue caused by a treatment that I was on. It's a whole other story. It was a really high dose. I was on 225 milligrams of prednisone a day. IV when I was in the hospital, which is 20% stronger than the pills, and then pills when I was home. So super, super high doses of prednisone, which will weaken your immune system. And my immune system was so weak that E. coli from my gut. So it wasn't even an external infection. It wasn't like I had fallen and scraped my knee, or it was from anything that had to do with the surgery. It was just straight up from my own body. My E. coli in my gut kind of slimed their way up into my lungs and settled there. And I ended up with pneumonia. My left lung had completely collapsed. They brought my mom in, unsure if I was going to survive the morning, and put me on a ventilator. Hence my ventiversary. Yay. And while I don't remember the following 8 days, I was on a ventilator for 6 days. I had 3 close brushes with death. I like to say that I was grappling with death. And spent 9 days in the ICU, followed by 3 days on the regular pediatric floor. Now, as many of you know, if you've been watching or if you've seen me on Osteo Bites, or if you know me in person, or if you're my friend like Vicky is, love you, you know that I have a really dark sense of humor. And when I say dark sense of humor, I don't mean inappropriate. I just mean like gallows humor. Like I just joke about the cancer and people are like, I can't believe you said that, just in the sense of like, it's very dark. But I'm lucky enough to have incredible supportive friends who I just so happen to have many inside jokes with, as many people our age do. You make inside jokes with your friends and you have nicknames for each other. And my mom had my phone passcode. Just, not because she wanted to snoop on my privacy, but just in case anything happened. And many of my friends' nicknames ended up as their contact in my phone. And so my poor mom, who's exhausted from not sleeping, she thinks her daughter might be dying, and she's just so stressed out. She's desperately trying to contact my friends to ask for extra help, or just to let them know kind of what's going on, if they want to see me, stuff like that. And she was going through my phone, could not figure out who was who at all. And so she had called the person who had recently texted my most recent text, which was Peppa Pig Girl. Thankfully, yeah, Peppa Pig Girl. Thankfully, it was my best friend, Madison, who was able to help my mom contact the others. But I found out later on that the conversation essentially went like this. Hello, is this Peppa Pig Girl? Serena? Is everything okay? She's like, Mia's in the ICU. I can't really talk right now. The doctors just came in, tell the others, and hung up. And I just think that there's something so weirdly funny about that interaction.
Yeah.
And
Peppa Pig Girl.
Yeah, Peppa Pig Girl. And so I'm just, my mom is just going through all my contacts, so confused. Just the idea of her going through my contacts, she's trying to be helpful and prepare herself and my loved ones for potentially the worst. She's just scrolling through these names like Little Bitch Sigmund and Silver Fox. And This Is So Sad, Alexa Play Despacito, and then of course Peppa Pig Girl. So it's like I have all these ridiculous contact names. And it makes me laugh, it makes my friends laugh, and they have stupid names for me in their phone. But what I would say as my advice is listen to your body. Obviously, I wasn't listening to my body right away, and I wasn't listening to my mom at first, and it's better to overreact rather than suffer the consequences, kind of like we were talking about earlier. Just speak up. And also just create a list of contacts, your closest people that you would want to know if something happens, with full names and phone numbers, maybe like on paper or in a note on your parent or guardian's phone, and give them your passcode just in case of emergency. I know that you talked about being delirious when you were on all those drugs. I ended up with ICU delirium from, being in the ICU for so long, being on the ventilator, being on so many, medically induced coma kind of drugs, that I couldn't even remember my pets' names. I didn't know what day of the week it was. One of the funnier stories, I know it's dark, but they asked me what day of the week it was, and I said A, B, C, D, E, F, G. I got to H before they stopped me.
Okay.
But that was a little, it was terrifying for my mom. Funny looking back on it though. And what really helped is my mom brought in pictures from home. And so just, like pictures that I had in my room of like my friends and I from high school, but I didn't have a lot of like recent pictures. So I started thinking that I was in high school again. And so that got a little weird at first. But it was just very scary because I knew something was wrong, but I couldn't communicate how I felt, what was going on. I was very frustrated. I was in pain. My throat was killing me from being, on the ventilator for so long. And I basically just had the mind of like a 5-year-old for like a good week. And it was almost like sundowners, where it's like the sun would go down, it'd be nighttime. It was nighttime when everything happened to me. And that's when I would really start to get delirious again. And so my mom knew that around 7 p.m., all right, it's time to give Mia her meds. It's time to just get her to bed, because otherwise she's just going to be like, who am I?
Yeah.
and other stuff like that. But just, I think this goes for just being comforted in the hospital in general. Bring stuff from home. You can pack stuff and then bring it in shifts, whatever. Anything that reminds you of life outside of the hospital and a place where you're more comfortable will center you and ground you faster. Talking to your friends, having friends visit, that'll also be helpful, obviously within COVID guidelines, depending on where you are and what they are. But there's a lot of unexpected scary stuff, as you know, that goes along with cancer. And this is just kind of our way of saying, advocate for yourself, speak up, keep a good list of contacts,
With specific names.
so specific names would really be great. But do you have any other like specific ways that you've coped kind of like with the unexpected? Like you said that you were like you stayed in for 6 weeks rather than 10 days, so like were there any ways to help you get more used to the hospital?
I'm not really sure in that way, but I would just say, like, especially going into surgery, have like everything ready. Like, you could be in there for 2 days, you could be in there for 2 months. Like, you really don't know what to expect. So, as you said before, just expect the unexpected in a way. Like, it's better to overpack as well. Because, like, it's better to have too many activities than be sitting there, in pain with nothing to do. But
As much as I'm annoyed by the amount of coloring books people sent me, I'm not an artsy person. I don't know why people think that cancer patients need all these coloring books. I appreciate it. I appreciate that they want to send me something, but you also could have made a $10 donation to a pediatric cancer research fund like MIB. But I got like 10 of the same coloring books. I donated them to our child life program on the floor of the hospital. But things like that can be comforting. You just kind of have to find what really speaks to you. Like, I would love bringing my headphones in and just listening to music. That kind of made me feel normal again. Just things to kind of help you adjust, because with cancer, you just have to roll with the punches. That's the best way to adapt. And if you get knocked down and it takes you a little bit longer to get back up, that's okay. You're not any weaker. You're not any different than other cancer patients. I mean, everyone's, unique in their own cancer journey, but everyone has their ups and downs. There is no good cancer. Everyone's just getting hit really, really hard, and chemo is exhausting and radiation is exhausting, and all of it is scary, and you just kind of have to go back to the things that make you happiest. Whatever.
Sometimes I feel like I regretted it because I would be on TikTok. I think one day it was 16 hours I was on it, but whatever gets you through.
Yeah, whatever
honestly.
gets you through, as long as
yeah.
you have a good time. But I agree. You can even decorate your hospital room. My mom and I did that a lot. One of our favorites, it was around a really big football game. I was at the University of Washington at the time, and was taking a year off for treatment. And we decked out the entire room in UW gear, and it would look like a tailgate in there. Like it was, we had all these little husky stuffed animals because that was our mascot. I had a purple UW blanket. We had purple and gold lights. We had like all this. It was just so much fun. And when you really lean into your community, your close friends, the cancer friends that you'll hopefully make along the way as well. Maybe the cancer is the friends we made along the way. No. But you just have to lean into your comforts and don't feel bad. There's that saying that goes around that self-care is not selfish. Advocating for yourself is not selfish.
Yeah.
And deviating from what your doctors think, obviously they're experts in their field, but you're the expert of you.
Yeah. I remember at one point I was like, my siblings are coming home for spring break, so I'll take a week off. And my oncologist was like, sure, I don't really care. Like, do whatever. So I went on spring break, and I was so prepared to go to the hospital. And then suddenly I didn't get fevers after cisplatin from then onwards. So it was just a week trip to the beach.
Yeah. It's social support is the best thing. Oh, I think you're frozen. Now that's scary. A Zoom freeze. Vicky, come back.
Sorry, it's cutting out.
She has resurfaced. I was scared there for a second. That's the real spook of the day.
Yes.
But have you done like any since we're speaking, since this is our spooky episode, have you done any Halloween costumes revolving around you being bald? Or since you've like been going through treatment, have you done like anything for Halloween?
I wish I would have, but I just really didn't do anything. Like, especially like during treatment, I think I wasn't in the hospital, but I was just sitting at home, like watching a movie. Like, that was kind of it. But I always thought about doing 11.
That
like
would be
the
OG.
like
you really could
1.
pull that off.
Well, right now my hair is a little long at this point, but yeah.
There's a bunch of other characters that you can do. I was invited to a costume party that's actually next month. But I'm thinking that, so it's villain themed, and again, nothing against her exactly, but I just think it would be really funny. I think that some people do think that she's a villain. So I think I'm gonna flat iron my hair or just kind of blow dry it, which is really difficult saying with how curly it is. But it'll be decently long, and I just need to get like a lot of volume, but like have it straight, and just wear giant sunglasses and like designer goods or fake designer goods, what have you. And I think I'm gonna go as Kris Jenner.
I love that.
And I think that's gonna be really funny. But my sophomore, technically it would have been my junior year, but it was my sophomore year of college. I had my leg scar out, so I wore like bike shorts, and then I got fake blood, and I put it all over my scar. And then I put them like on my port scars too. I like cut holes in the shirt that I got, but I just ordered the shirt from Amazon, and it says I'm fine, but then there's like a huge fake blood stain that's right here.
Yeah.
So I was just tearing up the shirt and I was in the bike shorts and I was just wearing comfortable sneakers because I couldn't wear heels or anything. Like I can't wear heels anymore. Like that's just gone. It's not like I was like, it's Halloween and I'm a sorority girl and I'm going like, it was like the most comfortable I could be. But it was just this t-shirt with, the blood and the I'm fine. And then I ordered a hand puppet that was a shark. So it was a shark attack victim.
Oh.
With the I'm fine. And then with the leg, and people were like, whoa, how'd you draw that scar? And I was like, special effects, man. And it's my best scar. But that was a really fun one. There's so many good ones. When I was bald, I wanted to do Pitbull, but I was never bald enough in October to do it.
Oh, really? See, I was very bald. Pitbull all year round.
It's, I mean, Mr. Worldwide, Mr. Year Round,
Yeah.
Yeah. But yeah, I just think that being comfortable, and holidays can get weird with treatment. You never know what's going to happen, but just celebrate when you want, when you can, and have a good time and roll with the punches. Roll with the punches is my best advice.
So I think we're just about out of time now. So thank you for tuning in to OSTEAo, the Osteosarcoma podcast. Be sure to follow MIB Agents on social media at the links in the description for all the intel, as Mia told us earlier. Thank you so much for being here with us today. We're your hosts, Vicky
and Mia, and until next time, stay spooky, and that's the tea.